Good morning, good afternoon, good evening, wherever you are working. I'm Dr. Prajwal Pakrel, currently the co-chair along with my fellow colleague, Dr. Zarmia Twatwa from Uganda for NCD Prevention and Health Promotion Group, World Federation of Public Health Associations, Geneva, Switzerland. This is a webinar initiated by NCD Prevention and Health Promotion Group, WFPHA, Geneva, Switzerland, and we plan to take this initiative forward and conduct webinar every month in the field of NCDs. Today, we have with us Professor Yael Bar-Zeev from Hebrew University of Jerusalem, Israel, and she will be talking about how are tobacco companies circumventing tobacco control legislation in Israel. Before going on to the before handing over the floor to Professor Yael, I would like to give a brief introductions of bio of Professor. She is a public health physician and behavioral scientist. She's a tenured associate professor at Brown School of Public Health and Community Medicine, Hebrew University of Jerusalem. She has extensive research experience with over 1.7 million grants and 100+ publications. Her research focused on influence of tobacco use and smoking cessation outcome in vulnerable population. She is the chair of Israel Medical Association for Smoking Cessation and Prevention, and she has advocated successfully for extensive tobacco control legislation in 2020, advertisement ban, a point of sale ban, and plain packaging. Professor Yael, over to you.
Thank you. Thank you very much. I'm going to talk today about how tobacco companies are circumventing tobacco control legislation in Israel. A lot of my talk will focus on a very large study that I was a part of that is called the I2I, Investigating IQOS in Israel and the US, which is in partnership with the colleagues from the George Washington University in the United States. Now, just a little bit of a background about smoking in Israel. So smoking rates in Israel in the past have been quite high. They've even been to around 45 to 50% in the early 1980s. And they've slowly declined and right now are around 21% in the last decade. There's a lot of differences in smoking rates across sex and ethnicity. So you can see in this slide here that Arab men in Israel have the highest smoking rates at almost 40%, whereas Arab women have the lowest smoking rates at around 10%, with Jewish men at around a quarter or 22%, and Jewish women a little less than that at around 15%. But you can see those very clear distinctive between the gender and the ethnicities in Israel. What we've also seen in the past a few years is that the emergence, just like in the rest of the world, of a lot of different products. So, and this is mainly among young people. So we are seeing a lot of experimentation with various products like electronic cigarettes, roll your own cigarettes, and also IQOS, which is a heated tobacco product. And I'll talk a little bit more about that. So the landscape of tobacco use in Israel and around the world has changed a lot in the past years. From it used to be mainly one product, the combustible cigarette, and today we are seeing people use other products and multiple products. So a person can use both cigarettes and both electronic cigarettes and other products as well. Now, Israel has done, throughout the years, has implemented a lot of different tobacco control legislation following the Empower advised by the World Health Organization. So back in 1983, Israel was one of the first countries in the world to implement smoke-free legislation covering a lot of public places. Israel also imposed marketing restrictions on marketing in TV and radio, had major increases in tax, and in 2010, coverage of all smoking cessation services, including both behavioral therapy and pharmacotherapy. And a lot of that tobacco control legislation has helped reduce tobacco use throughout the years from the 45 to 50% that we had to around 20% that we have today. However, as you saw in that graph that I showed you in the beginning, we're pretty much at the 20% rate in the last decade, and we haven't been able to lower it from that rate, whereas other countries, high-income countries that are similar to Israel, like the UK and the US and Australia and New Zealand, have reduced smoking rates to a much lower rate of around 10 to 13%. So we definitely can improve our smoking rate. And what happened was that in the early 2019, we managed, it was a group of a lot of NGOs together with academia and some MKs that were very from all of the political parties. So these were MKs of the parliament coming both from the right and left wing, all coming together, and we managed to pass a very extensive tobacco control legislation in parliament. And this included, first of all, that any of the tobacco control regulation in Israel will cover all tobacco and nicotine products. And this is actually quite novel compared to other countries. So all of the legislation includes also electronic cigarettes and heated tobacco products. It also included a complete advertisement ban. So before this legislation, it was only prohibited to advertise in TV and radio. And after this legislation, this would include internet advertisement, billboards, any public places, and also the point of sale. Unfortunately, the advertisement ban excluded print media, and this was because of a lot of advocacy from the print media saying that they will collapse if they don't have the money from tobacco advertisements. However, it was excluded print media, but it forced the print media to include counter ads. So any advertisement that the tobacco companies put in the newspaper, they had to also pay for another advertisement that would be sponsored by the Ministry of Health with education about smoking harms. And they were only allowed to have one advertisement per newspaper. So if that newspaper is a daily newspaper, it can only have one advertisement per day. If that newspaper is a weekly newspaper, it can only have one advertisement per week. And it was also excluding any advertisement in newspapers that are predominantly intended for kids. So anything that has to do with entertainment or that is targeted at kids was not allowed to have any advertisement at all. It also included a point of sale display ban. You're not allowed to see any of the tobacco products at the point of sale. And it included plain packaging. So again, Israel was the first country in the world to mandate plain packaging for electronic cigarettes and heated tobacco products. And this is just a picture of the celebration that we had at my house after the bill was passed. It includes all of the representatives from the NGOs, academia, and the MKs that were involved in this process. Now, I just want to sort of show you the way that the packages were in Israel before this legislation. So you can see that the package was branded. The warning was only a textual warning, and it covered only 30% of the package. And there were 12 rotating warnings in the back and the front of the package. The front of the package was in Hebrew, and the back was in Arabic. And you can see here the way that the packages look now. You can see that the package, first of all, is in plain packaging. And they chose the color that is supposed to be the ugliest color in the world. And the font is, there's exact legislation on how big the font can be and what exactly can it say. And there's no branding whatsoever. And the warning covers 65% of the package. But unfortunately, compared to other countries that have put in graphic health warnings, Israel only has textual health warnings that cover 65% of the package. And like I said before, Israel was unique in the fact that this is not only for cigarette package, but it's also for heats, which are the cigarettes for heated tobacco products, and also for the liquids for electronic cigarettes, and also the packaging for electronic cigarettes themselves. Like I said before, compared to all of the other countries that have implemented plain packaging, Israel was unique in the fact that it didn't implement graphic warnings alongside the plain packaging, but kept only textual warnings. And this is quite unique in the sense that the person that was actually opposed to graphic warnings was the Minister of Health himself, on the basis that it was not aesthetic to see these graphic warnings. So we weren't able to pass this. But after he retired from Parliament, and just earlier this year, we have managed to pass a legislation that will require graphic warnings on all packages. So this will be requiring graphic warnings also for heated tobacco products and electronic cigarettes. However, this will come into place only next year. They're still working on the exact regulation to put this in place, but it should start sometime next year. As I said before, we also still have advertisements in the print media, and I'll talk a little bit more about that as we go. So findings that I'll present today come from a very large study called I2I, investigating IQOS in Israel and the US. This is an NIH R01 funded study. And the PIs are Professor Carla Berg from the George Washington University and Professor Hagai Levine from the Brown School of Public Health at the Hebrew University. And together also our collaborator was Professor Lorraine Abrams from the George Washington University. And Amal Khayat is the doctoral student working on this grant. And some of the papers that I'll be presenting today were led by her. So a lot of the focus of my talk today is going to be about IQOS. IQOS is a heated tobacco product, so it's not a regular cigarette, it's not a combustible cigarette, and it's not an electronic cigarette. So as opposed to combustible cigarettes, here the cigarette is a bit shorter. It's about, I would say, about 40, I don't know, a third of a regular cigarette, but it is put into this electronic pen. And when you start the electronic pen, it heats the tobacco stick about 400 degrees. So there's no burning of the tobacco like there is in combustible cigarettes. You just heat it up to a very high degree. But it does have tobacco. So as opposed to electronic cigarettes are electronic devices that heat a liquid. And that liquid contains nicotine and other substances, but it does not contain tobacco. A heated tobacco product does heat tobacco. So that is a major difference between these products. And IQOS is a product that is manufactured and promoted by Philip Morris International, which is one of the leading tobacco companies in the world. And it is actually the leading heated tobacco product worldwide. So right now it is promoted in more than 30 to 40 countries around the world. Now, when IQOS entered Israel, it was actually one of the first countries in the world that Philip Morris decided to introduce IQOS. The first one was Japan and then Switzerland. But after that, Israel was one of the first countries that had introduced IQOS. And it entered in December 2016. And when it entered Israel, because Israel does not have a pre-market authorization of tobacco products, it basically entered as a consumer product without any regulation whatsoever. So it could be sold to minors, you could advertise it any way you want, and it was a consumer product. And it actually took a Supreme Court, it took an NGO filing a Supreme Court appeal for the Minister of Health and it forced the Ministry of Health to regulate it as a tobacco product. So only 4 months later, in April of 2017, it was regulated as a tobacco product. And at that time, that included weak tobacco control regulation. So restricted advertisement in TV and radio. It wasn't allowed to be used in smoke-free areas, and you cannot sell it to people under the age of 18. It took another appeal to the Supreme Court by an NGO to get it to be taxed as cigarette, because even though it was regulated as a tobacco product, the Minister of Finance did not want to tax it as cigarettes, and we had to appeal again to get it taxed as a cigarette. And then in March 2019, the first installment of the legislation that I talked about went into effect. So this was the advertisement ban, the complete advertisement ban, including online advertisement and at the point of sale, but excluding the print media, as I said before. And in March 2020, the plain packaging with the 65% textual health warning and the display ban at the point of sale went into effect. So you can see that it went through various regulatory periods as the regulation progressed in Israel. And so part of this study, what we did was we audited point of sale, and we did a survey with merchants at the point of sale. We surveilled all of the advertisements in Israel and specifically across the print media. We also did a cross-sectional survey with consumers, and we did qualitative interviews with consumers. And for today's talk, I will focus on the audits at the point of sale and the surveillance of the advertisement specifically in the print media. So I'll start with the point of sale audits and survey, and just a little bit of background. So the point of sale is a very important venue for advertisement. And we know from research that the point of sale advertisement leads to higher smoking initiation and use among youth. We also know that it interferes with people trying to quit smoking, and it triggers relapse among people that have already quit smoking. We also know that tobacco companies, specifically for cigarettes, have used in previous years direct marketing to the retailers themselves. So they talk to the retailers and tell them and ask for designated shelf spaces. They give them special displays for cigarettes. they provide discounts or price reductions, and they also provide educational material to the retailers in order to inform them how to communicate directly with consumers. So the retailers are a very prominent venue for tobacco companies in order to advertise and promote their products to the consumers themselves. And what we did in this study was we did 2 rounds of audit. So we started the first round of audit. We did it in late November, December of 2019. This was when the advertisement ban at the point of sale was already in effect, but before the display ban went into effect. And we audited 80 point of sale that sold IQOS. So eligibility criteria was that they had to sell, I'm sorry, not IQOS, but they had to sell the heats, the cigarettes themselves that are for IQOS. IQOS itself was mainly sold on the internet and at flagship stores of Philip Morris. But the heats, the cigarettes, were sold in regular point of sale, like kiosks and convenience stores. So we audited 80 point of sale in 4 of the largest cities in Israel, in Haifa, Jerusalem, Tel Aviv, and Beersheba. And then we repeated those audits a year later, in April to August of 2020, after the point of sale display ban and the plain packaging went into effect. And we managed to return to 60 of the original point of sale that we audited in the first round. And we added additional 27 to have a large enough sample. So there was 87 a point of sale in the second audit. And we used the adapted version of the standardized tobacco assessment for retail settings. We adapted it specifically for IQOS and heated tobacco products. And we had a pilot study to validate this version of the standardized tobacco assessment tool, which it includes store characteristics. What are the products that are sold? What is the price of the products and any price promotion across different products? Any promotional strategies that they employ? And placement of the products, including special displays and whether they placed it near youth-oriented merchandise, like, for example, near candy or near toys, and whether they placed it in the eye level of youth. So it was placed on the counter at 1 meter from, which is considered a youth eye level of the product. And a few months later, we also did a cross-sectional survey with merchants that work in point of sale that sell IQOS or heats, the cigarettes for IQOS. And we used either phone interviews or an online link that they could fill out themselves. We reimbursed them with 100 new Israeli shekel if they completed the survey. And out of 171 eligible point of sale that we approached, a quarter completed the survey, which is considered a very good response rate for this type of population. Now, just to show you what we found in the first round of point of sale audits, I'm just reminding you that this was after the advertisement ban was put in place, but before the point of sale display ban and plain packaging were in place. So the stores were mainly convenience stores and kiosks and a little bit of grocery stores and supermarket. And most of them were in medium and high socioeconomic neighborhoods. So only one of the point of sale was in a low socioeconomic neighborhood. All of them sold cigarettes, about 50% sold e-cigarette. All of them sold the heats, the cigarettes, the heated, the tobacco sticks, the heated tobacco sticks, but only one of them sold the actual IQOS device. A high percentage had at least 3 of the heats flavors, and on average, they were more expensive compared to cigarettes. But we didn't see a lot of ads or price promotions. These were very uncommon. And about 21% had special heats display case. And I'll show you a little bit of how this looked. You can see this very simple cardboard display cases that were specific for the heats. And this meant that they were separating where these cigarettes are from where the regular cigarettes. So this was not in the regular cigarette displays, but a separate display case. And you can also see that it is put next to processed food and candy that will be on the counter and the eye level of youth in some of these point of sale. We also saw that there were a lot of signs that are circumventing what the intended of the display ban. So this was a few days before the display ban was going to be put into effect, and they were getting ready for the display ban. So they had these special displays. But you can see, first of all, that they had these very generic signs that say, here you can get tobacco products or just cigarettes. And they're very prominent displays. So even though you're not allowed to see the tobacco products, they pretty much that's what you look at when you come to the counter. That's the first thing that you can see. And you can also see that they're not hermetic. So you can see the tobacco products from the sides. You can see them even when it's closed, you can still see some of the tobacco product. Just as a summary of the first round, we didn't see a lot of marketing of IQOS, the heated tobacco product, at the point of sale. But we did see that 20% had a special display, that they're differentiating it from other tobacco products. They might be targeting higher socioeconomic populations due to the price that was more expensive and the neighborhood location. And we did see circumventing of the legislation. So they're circumventing the advertisement ban by using generic signs that don't say a specific brand, and by using very prominent, not hermetic displays at the point of sale. And this was published in Nicotine and Tobacco Research, and you have the link if anyone is interested in reading more about this study. The second round of point of sale, what we saw was that there was an increase, a very high increase in point of sale selling the IQOS device. And we also saw a lot of signs. So in the first round, we almost saw no signs, but now we saw very common that the point of sale will have signs. However, they were compliant with the legislation, and I'll show you some pictures as we go. And again, an increase in those having a special display case for the heats. And these were very sophisticated display cases, not the cardboard case that I showed you before. And very disturbing is that we saw that only 9% of the point of sale were compliant with the point of sale display ban. So more than 90% of the point of sale, you could still see some of the tobacco products at the point of sale. So very few were compliant with the display ban. And this is how it looked. So you can see that these are basically purchase cues. So there's a lot of generic signs saying here you can get heated tobacco products or alternative to smoking cigarettes. Now, these are allowed by the legislation because they don't say the product's brand. They don't say IQOS or HEETS anywhere. So they're allowed. But they are using a sophisticated form of branding. And this is a bit gray because if you look very carefully, you can see that all of these signs have the same colors. And these colors are corresponding to the HEETS flavors. So HEETS flavors are not, they don't use descriptives of flavors like menthol or, like flavors like they do in e-cigarettes. They don't say like cherry flavor or anything like that, but they use a color description. And this is very sophisticated because it's already thinking ahead if they will ban using descriptives of flavors, they're already okay because they use colors. So instead of saying, for example, menthol, the flavor of HEETS that corresponds to a menthol flavor is turquoise. And they use that color of turquoise to say that they have that flavor there. So this is a very gray area because you could say that this is a type of branding, but it's not sort of distinctive branding because it doesn't say IQOS or it doesn't say HEETS and it doesn't use a brand, like a logo of that brand. There were also electronic signs saying, again, here you can get tobacco products or here you can get heated tobacco. And basically the same point of sale could have multiple signs. So it could have a flag and one sign that is regular and one electronic signs and in different places inside the point of sale. This study was also done during COVID, and what we saw that they were using the COVID barrier. So this is a barrier that was put to shield the merchant from consumers, so that if somebody sneezes or even just talks and his aerosol comes to the merchant, he's protected in some way from the aerosol. But they use that to put here signs that you can get heated tobacco. So they even use that as part of what they were doing. And this is an example of the very sophisticated display, special display for IQOS. So just remember that cardboard that I showed you in the beginning and how sophisticated they got. So this is when it's off, you don't see anything, but once you press a button, you can actually see through and see the HEETS and the IQOS device through this display. And it has these special signs, and some of them have those colors around them. And these were all placed on the counter, which again means that they're in the eye level of use. And some of these also had a QR code, which led to the Philip Morris IQOS website in Israel, where they asked participants to register, and that way they have their own details for all of the people, so they can advertise directly to these people, because that was allowed in the legislation. They're allowed to do direct advertisement if someone signs up for that. So they're putting QR codes at the point of sale to get people to sign up, and that way they can direct advertise to these people, circumventing the advertisement ban. We also saw signs for other tobaccos. So these are signs for shisha or water pipe and roll your own tobacco. Just to summarize the second round, we saw very prominent marketing of IQOS at the point of sale, but compliant. I put in a question mark because of that branding with the colors. We saw an increase in special displays and an increase in the number of selling the IQOS device, and we saw signs of the circumvention of the legislation. So using multiple different forms branded with colors of signs that act as purchase cues, and using very prominent, not hermetic, special displays that also have QR codes that ban the advertisement ban and the display ban. And this again was published early this year in Tobacco Control, where you can read more if you're interested. So then we did a survey with the merchant themselves, and we had 43 merchants that answered our survey. Most of them currently sold heats, but about 15 also sold the IQOS device. Most of these were convenience stores or grocery stores, but a few were also liquor stores or tobacco shops. Again, we saw that most were in medium and high socioeconomic neighborhood ranking, and about a little bit more than 50% of the merchants were current or ex-smokers, and about a quarter also were current or ex-users of IQOS themselves. The first thing that we asked was attitudes towards IQOS, and we saw that a lot of them had positive attitudes. Around 40 to 50% of the merchants had thought that heated tobacco products, that IQOS was less harmful compared to cigarettes, that it produced less smell compared to cigarettes, and it was cleaner compared to cigarettes. And about a quarter thought that this was an innovative product, a high-tech product, and about a fifth didn't distinguish between heated tobacco products and electronic cigarettes. And this is important because on that scale of harm, where you put combustible cigarettes as the most harmful product and electronic cigarettes as a less harmful product, heated tobacco products are more close to combustible cigarettes because they have tobacco in them, and they're not the same as electronic cigarettes. But a lot of the merchants were not differentiating them from electronic cigarettes. And when we asked them about marketing strategies, so about 46% said that they had special displays, and they also had very specific salesperson. So they had one salesperson coming to talk to them about Philip Morris cigarette brands, but they had a separate, specific salesperson that came to talk to them about the IQOS and the heat. They also said that they received financial incentives based on their sales, invitation to parties and social events, price discounts based on how they promote the product, price discounts for them to use the product, and free samples for them to use and get acquainted with the product. They also talked about promotion to customers. So they got price discounts and price promotions, such as buy one, get one free, that was directed at customers themselves. And what we saw when we asked the merchants about these strategies before and after the point of sale display ban, and they said that these strategies increased after the point of sale display ban. So they were using more promotions that were directed at the merchants and at the consumers to sort of circumvent the point of sale display ban after it was implemented. And I'll just skip this for a second and just talk about interactions with Philip Morris. So they talked about having more than almost 60% of them had some interaction with Philip Morris through their specific salesperson. So either they got direction regarding placement, where to put the products, how to communicate with consumers about these products, how to talk about IQOS and heats compared to other tobacco products and how they're different, and what is the target audience. And this was higher among point of sale that also sold the IQOS device. They also talked about increased interaction after the display ban, and they said that they were provided with free display cases and signage to comply with the legislation. So all of those nice display cases and signage that we were seeing were actually provided free from Philip Morris. They talked about about a third said that they got information on how to understand the new legislation, and some also got information specifically on how to circumvent the legislation and not get caught. And this again was published in Tobacco Control a while ago. So just to summarize this, we saw specific marketing strategies at the point of sale, both to promote the IQOS and heat and differentiate them from combustible tobacco products. We saw that there was increased marketing strategies directed at the retailers after the new legislation went into effect, with increased price discount to consumers. And they were circumventing the point of sale display ban through special displays, flags, and signs, generic signs, multiple purchase cues at the point of sale. We also saw that they were targeting those point of sale that carry the IQOS device. These point of sale received more instructions and more promotion. And basically, in some way, we can say that the retailers themselves, because of the legislation that sort of takes away from what the tobacco company could do at the point of sale, they're trying to make the retailer in some way their representative, and they're incentivizing them to spread the company's message to consumers directly. So now we'll move on to what we did when we were surveilling the advertisement, and we looked specifically at the ad spend and content analysis. And these are two studies that were led by my PhD student, Amal Khayat, and both of them have been published in Tobacco Control. So what we did here was we received data from IFAT, which is an advertisement monitoring company. And basically, we asked the data from when the date IQOS entered Israel, which is the end of December 2016, up to the early August 2020. And we received data for all advertisement that was from Philip Morris. So it could be either for IQOS or their cigarette brands, and included what date the ad was published. And that allowed us to know at what regulation period the advertisement was published. Was it published when there was no regulation on IQOS? That was the first period. Was it published when there was weak regulation before the legislation went into effect? That's the second period. Was it published when there was only the advertisement ban, but not the display ban and plain packaging? That's the third period. Or the fourth period, when there was already everything, the point of sale display ban and the plain packaging. We also got the data for which target group this advertisement was directed at. So whether it was the general population of Israel, or whether it was the Arab population, the ultra-Orthodox Jewish population, or the Russian population. And this was known either by the language of the advertisement or by the media that they were using. So it was a specific newspaper that was targeted for ultra-Orthodox. That way we would know that this was an ultra-Orthodox newspaper. We got all of the data for the ad spend. How much money did they spend advertising this ad? What type of media channel? Was this digital or print media? What was the name of the media outlet? And that way we could see what kind of theme. Was this a business newspaper? Was this a sports newspaper? Was this a general news newspaper, and so forth? What were the dimensions of the advertisement? Was it a double spread ad, one page or less than one page? And the content itself. And basically what we did was we compared the weekly average number of ads and the weekly average ad spend. And we also coded all of the ads for the visual and text of all the unique ads to look at this. So what we saw, first of all, is that they're spending a huge amount of money to publish both, to publish both IQOS and cigarette ads. So, but they were spending more money to publish IQOS and heats than to publish cigarettes. And we also saw the average weekly number of ads for IQOS was larger than that for cigarettes, and the average weekly ad spend was larger for IQOS than it was for cigarettes. Now, what you can see in these two graphs is the average ad spend for IQOS, that's the top figure, and the lower figure is the average ad spend per week for cigarettes. And I just want to highlight a few things. So first of all, we did this looking for each week, and you can see here the regulatory period. So one is when there was no regulation for IQOS, 2, weak regulation for IQOS and cigarettes, 3, only the advertisement ban, and 4, when also the display ban and plain packaging went into effect. So I just want to highlight a few things. First of all, when IQOS entered Israel, and it was regulated as just a consumer product, they only advertised IQOS. They did not advertise any cigarettes at all. Then you can see that when IQOS taxation went into effect because of the Supreme Court decision, and they were very disappointed by this, Philip Morris, because they fought it very strongly. But once it went into effect, they stopped advertising IQOS for quite a lot of time and went back to advertising cigarettes at a very high volume. Then you can see that once the advertisement ban went into effect, both IQOS advertisement and cigarette advertisement went down very abruptly, which makes sense because they're only now allowed to advertise in print media. And I want you to notice also that there was this surge in advertisement that took place after the legislation went into effect. After the legislation was legislated in the parliament, the vote was in the parliament, but before it went into effect. So in that few months where it already passed in parliament, but it wasn't yet into effect, they of course spent a lot of money advertising as much as they can to consumers. Now, what we saw was that most of the advertisement was directed at the general population, and they only started targeting subpopulations in regulatory period 2 after it was regulated as a tobacco product. And if we looked only at those specific subpopulations, we saw that we see some data that shows that they might be targeting the ultra-Orthodox Jewish population, because 55% of the IQOS ads and 87% of the cigarette ads were targeted at the ultra-Orthodox Jewish populations from all of the subpopulation. And this is quite interesting because it's actually, the Arab population is a much higher, is a much greater subpopulation in Israel. There's 20% of the population are Arab, whereas ultra-Orthodox Jewish, there's only about 11% of the population. So there's more Arab population than ultra-Orthodox. The second thing is interesting is that male Arabs have the highest smoking rate in Israel, and yet they didn't target the Arab population. And one of the things that we found when we looked specifically at the ultra-Orthodox, that almost all of the ultra-Orthodox advertisement that was in ultra-Orthodox newspaper were in one specific newspaper. And this was the Modia newspaper, which has connections to the Minister of Health. So the Minister of Health at that time, one of his family members owns that newspaper. So we can't prove, but this shows that there might be some kind of connection between the advertisement and trying to influence the Minister of Health in some way. What we also saw that in the last period when the tobacco control legislation was the most extensive, so this was advertisement ban except print media, display ban, and plain packaging, we saw that there's an increase in double spread IQOS ads. So if you remember, I told you that they're only allowed one ad per newspaper. So what they did was enlarge the ads because the legislation did not say how big the ad could be. So most of their ads, not most, but 40% of their ads were now double spread IQOS ads. We also saw that there was an increase in ads in indoor settings, which in some ways, they're trying to sort of circumvent the fact that you're not allowed to use this in public spaces. So they show the use of IQOS in places that are indoors to sort of show that you can use this as opposed to using a cigarette. You can use this also when you're indoors. And we also saw that as regulation increased, there was an increase in additional details queues. So they had website listed or QR codes that direct you to their website for additional advertisement, and also retail accessibility. So actually listing point of sales addresses where you can get these products. And this is just to show what I've just talked about. So there was a lot more using of indoor settings in the IQOS ads compared to the cigarette ads. We also saw that IQOS had almost all of them had age and user restrictions. So all of them had like this little tiny wording that said that it's not allowed for people who are not smokers and are under the age of 18, whereas almost only very few of the cigarette ads had that kind of restrictions. Most of them had those additional details, website or QR codes, whereas more of the cigarette ads, they were more focused on having price promotion. So they're using different techniques for the IQOS ads compared to the cigarette ads. We also saw that the main theme that was in these ads was different. So cigarette ads were more focused on the quality of the cigarettes, whereas IQOS ads were more focused on the innovation of this product. Both of them were focused on freedom and choice of the person, but IQOS ads, almost all of them also included comparative claims, like saying that these are better than cigarettes or having less smell than cigarettes and stuff like that. And just to give you a little bit of examples of how these ads look like, so you can see here that they show the device in an indoor setting. You can see that it's a very clean, very sophisticated sort of way. The theme itself is closer, which means you can get close to people because it doesn't have any ashes. It has less smell, and that's part of what it says here. It has a link that you can press that you can actually get an appointment with someone to talk about IQOS. And it has, in this one, it has a coupon and lists of places that you can find this product. And I want to talk a little bit about using of branding. So even though, if I show you this, even though I don't tell you what product this is, I'm assuming most of you will know that this is Camel cigarette. And if I show you this, most of you will know that this is Marlboro, even though I don't say Marlboro. And we saw that they've started to do this in the print media. So even though they're only allowed to say the Marlboro on the plain packaging without any branding, they've started putting the branding into the print media advertising as a way to sort of circumvent that. And you can see that they've also used a QR code, again, to direct the person to their website where they can give him more information. So they're using the print media exclusion from the advertisement ban to actually increase their advertisement to consumers. And we saw this before when we saw the QR code being used at the point of sale. Additional ways that we saw that they were circumventing the legislation was, if you look at this here, which is the plain packaging. So the legislation only focused on the outer packaging. So what they started to do was advertise inside the packaging and brand the inside of the package. And you can see a package here with branded inside, and also even in in an advertisement in a newspaper where they're using inside advertisement both in the package and on the cigarette itself. We also saw that they're using this in the print media. So they're using this inside package advertisement and on the cigarette itself in the print media advertisement. And because the plain packaging only allows you to use the same font and you can't use any colors, they've used the print media to highlight the different colors and the different flavors and make it more distinctive for people in a way of circumventing the plain packaging. One of the ways that we saw also that was before the plain packaging went into effect, they tried to sell tins, like these are tins that are branded. And the thought behind this was that if people buy these, then they can buy the plain packaging, but take out the cigarettes from the plain packaging, put it into this branded tin, and just walk around using the branded tin and not the plain packaging. So if they sold enough of these before the plain packaging, people will still have these branded packaging used after the plain packaging went into effect. Now, we've managed earlier last year, we've managed to pass legislation banning, excluding all advertisement from the print media, but at the last second, they managed to postpone this to 2029 due to the interference of the newspapers. Again, the media itself that was very against this advertisement ban. But because of the studies that I just showed you now, we managed to introduce a little bit of changes to the legislation until the complete advertisement ban goes into place, where they're not allowed to use any more comparative claims. They're not allowed to use any packaging that is not plain, and they're not allowed to use coupons or any QR codes linking to website in the print media advertisement until the complete advertisement ban goes into place. So I just want to sort of summarize everything that I've talked up to here now, basically showing that in some ways, unfortunately, they're smarter than us. And every time we pass a law, they find ways to circumvent that law and to pass and sort of get around the intention of the law. And this is, in some ways, I hope that this talk will help people from other countries, if they are legislating something that is similar, to take these things into account and think about the wording of the legislation to try to counter these ways that the tobacco companies are circumventing the legislation, such as using specific wording of what is allowed. So instead of saying that advertisement is not allowed in the point of sale, we can sort of switch that and say exactly what is allowed. what kind of sign is allowed, how big that sign can be, how many signs can be, what colors are allowed to be used, what text is allowed to be used, if at all. So being a lot more specific in the legislation to try and prevent the way that they are circumventing the legislation. And that's it for me. Thank you very much. One of the questions that he had was, how does this ad strategy relate to bypassing restrictions using social media, viral TikTok, influencer? Is there any way to quantify social media versus official advertising stream using IFAD data? So unfortunately, one of the reasons that we did not include social media is because IFAD data is not very good monitoring social media, and it is a problem. And we're now trying to use different companies that do monitor social media, but it is very problematic because it's not confined to one country. So you can't really, look at social media that is just Israel, and people are basically seeing social media from all over the world. But there is certain data mining ways of looking at everything that is in social media to try and research that specifically.
I'm from Uganda, and of course, Uganda is one of the countries which have successfully at least enacted a law against tobacco, and we are implementing it. Now, the question is, because here we are finding the problem of now controlling the tobacco on the side of one, corruption, and this round tripping, because Uganda is both a transition of tobacco now, and the tobacco appears to be leaving the country, but at the same time, it comes back in a different form through what we call panya, or informal routes. And this kind of cigarette is not labeled the way the law actually prescribes, that there should be labeling of the cigarettes, about the advertising and the warnings about the dangers of cigarettes and whatnot. But this cigarette now comes back. How has Israel managed to control this kind of phenomena?
So there's two things that I want to talk about. One is you mentioned corruption, which I think is very important. And we know that the tobacco companies have a lot of ties with governments in different areas. And this is very problematic. And I can say that one of the NGOs that we were actually working with and helped us a lot was an anti-corruption NGO. So they had nothing to do with smoking, but their whole intent was about exposing corruption in government and in legislation. And they came, so for example, they were very much against lobbyists coming to the legislation process. And every time there was a lobbyist from a tobacco company in the parliament, they would start writing about it in the newspapers and talking about it and sort of highlighting that fact. And that helped a lot. There was actually a law that was passed because of that banned. It wasn't exactly a law; it was a regulation that banned tobacco lobbyists from entering certain committees in the parliament. The second thing is about how to sort of these other cigarettes or other things that are not under the legislation, and that is, I think what you're referring to is sort of like the black market, where a lot of cigarettes are coming in from other places, and this is a very big problem. We have that with a lot of smuggling also coming in from the Palestinian Authority and other countries that have borders with Israel. And I think, it's not my area of expertise, but the country needs a very strict border control also against these. One of the ways that I think that they do it is that you have to have like a specific sort of packaging that is only for the packaging that is allowed, and a lot of the countries do this because they want the taxes. So because all of this smuggling, they don't get the taxes. So one way of sort of getting the government to implement all of these anti-smuggling is to get them, because they would want the taxes that are lost if they're not coming in through the usual ways.
Thank you, Professor Yael. Now, so I have a few questions to you. Is there any tobacco law discrepancy in different tiers of health system of in the Israel context? For example, in context of Nepal, what I'm talking is we have a 3-tier of health system: federal level, provincial level, and local level. So is there any, discrepancy in laws in different tiers of health system? The first question. The second question is, what are the challenges? You highlighted very well in your presentation, but what are the challenges of tobacco law implementation? So that is another questions. And what are the effective ways of monitoring and supervising, this tobacco, act laws, and what actions should be taken, so that it could be regulated. And the fourth one is, recently, New Zealand banned, the tobacco sale for those who are born after the 2009. So any policies which Israel is thinking of in the similar line, for banning of tobacco products.
First one about the tires. That's an excellent question, and you see other countries that are like that. Israel is a small country, and basically, no, all of the legislation is at the national level. Theoretically, the local municipalities can legislate sort of specific regulations that are more restrictive. So, like, for example, they can legislate like that you're not allowed to like, they can add public places that you're not allowed to smoke that are in addition to the national level, but they can't be less than the national level. But currently, no sort of local municipality has ever done that. So in reality, it's only the national level. Regarding the challenges, I think the two main challenges the main challenge in Israel is actually enforcement. So we're pretty big on legislation. We know how to do that, but we're not that good in enforcement. So even though there's a ban on sales to minors, if you're a minor, it's very easy to get cigarettes in Israel. And as you saw, there's a display ban, but over 90% of point of sale are not compliant with that. So there's a low level of compliance, and if you walk around in Israel, there's still a lot of smoking in public places that you're not allowed to smoke. So pools and restaurants in the outer areas, people smoke even if you're not allowed to smoke. So I think that's one of our main challenges, and this is something that we haven't been able to tackle very good because nobody wants to do it, not the police, not the government, and not the local municipality. I don't remember your other. Can you remind me the other two questions?
So, effective way of monitoring and supervision. Okay. So what could be an effective way?
I think one of the problems here is that you have to do the monitoring. I mean, our study was the first study that was done in Israel about marketing strategies. Nobody did anything like this before, and it allowed us to actually see what is happening. So there has to be a way either for the government or for academia to get funding from the government to do those kinds of monitoring and surveillance, because otherwise you don't see what they're actually doing. I can say from a low resource point of view, like if you're living in a low resource country, what we do, by the way, is we actually have a group, all of our NGOs, like these people that are very invested in tobacco control. Sometimes we just do the monitoring and we let the government know. So anytime we see something that is not not correct, we alert the government and we ask them to take action. So sometimes I've had articles that were published that were not according to what the law permits, and I've just went to the government and had them removed and stuff like that. But it's like a mouse and cat struggle. There's no really good way because they're always a step above us.
So any initiative taken, to ban the tobacco products in
Oh, yeah. So first of all, I wanted to say regarding New Zealand that unfortunately the government went back on their legislation. And right now that legislation was canceled in New Zealand. So they're not doing that anymore. The UK are considering doing that. But since they just had a change of government, I don't know if that will go ahead or not. It is on the books in Israel, but it's a bit, so it's sort of like something that the government is saying they might do in 10 years from now, but it's not something they're considering in the near future. And I think, at the time, one of the challenges that we have is that the government is just, so we had this really good legislation in 2019, and then COVID went, and the Ministry of Health was only about COVID for 3 years, and now we have the war. So they're all about the mental health and things that are happening with the war, and they're not really open to putting a lot of efforts into tobacco control.
Thank you, Professor. And then two more questions in the chat. Any legislation regarding the regulation of nicotine content by POGA?
Yeah, so we actually have, so this is not for cigarettes, but for electronic cigarettes, they're only allowed to have up to 20 milligrams per liquid, just like the European directive. But I can say that nobody is enforcing that. So there's no actual border control that takes the nicotine content and makes sure that it doesn't go above that.
So there's another question from George.
Okay. Okay, that's a great question. So one thing I can say is that even though NRT has been available, well, first I'll read the question because maybe not everybody can see it. So this is a question from George Nons. He is saying that he is currently working on an NRT, nicotine replacement therapy project, at his local health district aimed at encouraging staff to quit smoking, but uptake has been very minimal even after promotion of the pharmacy service. And tobacco companies have very sneaky methods for circumventing advertising, resulting in continued consumption. And how can we influence and promote secession to a concentrated effort? Well, one thing I'll say is just continue. There's not a lot, but we just have to sort of continue and promote it as much as we can. We have to make sure that it is available as subsidized as possible. I don't know if the NRT that you are promoting is subsidized or not, but if it has a cost, then that means that people will not spend the money to use it. Make it as easy as possible to get. So a lot of places in the world, for example, have used mail out NRT. So they actually have, like if you know who the smokers are, you send them a package that includes NRT so that they can start using it, giving out free samples to people coming to clinics so that they can use NRT, using any methods of communicating cessation services. So one way is actually having links on the packages themselves. So forcing the tobacco companies that on the package, they will have a QR code that leads to cessation services in the country, for example, to the quit line or places like that. And you can also force them to have an insert inside the package. So this has been done in Canada, where they have an insert inside the package that promotes secession. So it's the tobacco companies that have to pay for it, but it actually allows you to promote secession.
Of course, governments and companies have got interest in the tobacco. The companies, of course, they make the money. And of course, governments sometimes they also make it from tobacco through taxes which they levy. Now, who do you think is the best person who can help in the monitoring of the implementation of the protocols to do with this tobacco control? Then the last question is, of course, personally I've appreciated your presentation. It's so nice and very easy to really listen to.
Regarding your first question, for many years, I've been working in tobacco control for many years, and we didn't actually get anything moving. And what changed was when we had a coalition of NGOs working together. So instead of each NGO sort of working apart, we formed a coalition that met regularly and had people from diverse, so we had representatives from local municipalities, we had representatives from the Ministry of Health, we had representatives from the academia, like myself, we had representatives from different NGOs, we had that representative from the anti-corruption NGO. So basically trying to sort of form, we had journalists that were very much interested and made sure to keep this all the time in the news. So it was a very, and only when we had all of these people working together for the same cause that we managed to get something to start moving. So, and I think that's part of a way that people, and also don't give up, because you write a letter, you write a letter to your parliament representative or to your head of parliament or something like that, and you think it doesn't do anything, but all of these little things add up and do, at the end, move something.
Thank you very much for your valuable time and extensive elaborate presentation. So we learned a lot from your presentation today. Hope we can get this, all these slides and the paper so that we can go and read it. and understand more about tobacco, you know, and learn from those experience to implement in our own country context, you know. So with this, I would like to end the webinar, and here and hope to see you all the colleagues next month. Thank you very much. Bye bye, Professor. Thank you very much for your time.
Thank
Bye
you
bye.
very much.
Thank
Bye.
you.